now, pharmacies across Britain are staging a day of action by turning off their lights in an emergency protest over government pay.
Well, join us to explain this is Thorrun Govind, who's a pharmacist and health expert and is a friend of this programme. Morning to you, Thorrun. Just explain, first of all, the deal with the government. You are often prescribing drugs, I think, at a financial loss to your business.
Yes, so pharmacies are, in simple terms, it's very complicated, but we purchase the drugs and then we get paid by the government after they are purchased. So they are not paying the amount that it's actually costing for us to get the drugs into the pharmacies. So pharmacies are experiencing severe financial problems. And there are actually pharmacies which are closing. So we've got in England, the lowest number of pharmacies that we've had since 2015. And funding has been cut in real terms by 40% since 2015. And it's impacting patients because, to me, most people are about a 20-minute walk away from their nearest pharmacy. But the impact of what's been happening means that people are having to go further to access their pharmacy. And we know that in deprived communities where the need is actually higher, and they've seen the biggest decline. So more than 1 in 10 pharmacies have been lost in the poorest 20% of areas in the last 6 years.
There's an irony, isn't there, Thorrun? This is happening at a time when the government is putting pressure on the pharmacies to do more and more, to take over the work of GPs, because so often people can't get to see a GP. So they're asking you to do more, but they're taking money away from you at the same time.
Absolutely. And really, lots of pharmacists are protesting today, and pharmacy teams by, we're not closing. This is not a strike. This is a symbolic protest to say, look, if you don't look at what's going on here, people are wearing black. Some pharmacies are turning out the lights in the morning, for example. We've got petitions going on across the country. But the very fact that pharmacists, who I have to say, we're not a bunch who get up and protest that often. We don't like conflict. We like getting on with what we do, and we like serving our local communities. The fact that pharmacists have felt pushed to this extent, to feel that they've had to go to these lengths to actually explain to the public and also to the government. And this is election time. So I want to know what the government and what parties are going to be doing for pharmacy, and also the medicine shortages that, we've spoken about before. Because it's just an untenable situation.
It is. Thorrun, just explain to us again, because I think this is what is most baffling to people. You're buying the drugs from the pharmaceutical companies. You then submit an invoice effectively to the government to say, this is what we've spent on drugs, everything from paracetamol to diabetics to statins to HRT medication. And the government are now saying, oh, well, I'm sorry, I know that's cost you £10,000, but we're only going to give you £6,000, so you have to make a loss. If that's what's happening, has it always worked that way, or what's changed?
It's got worse due to these funding cuts that we've experienced. It is due to the cost of medicines, but ultimately it's also down to the package of funding that the contract it offers for pharmacies, which hasn't kept pace with inflation. And also there's business rates that community pharmacy owners are also having to deal with. So if you think about all the pressures on the high street at the moment, and I mean, I walk down the local high street and it's closed. Not many shops still there, are there?
No.
But this is not an ordinary item. These are not, clothes. This is vital medication for some people who can't get in a car and access healthcare. People need to be able to walk to their local pharmacy. This is why so many patients are suffering because of this. There's absolutely no doubt about it. And we've had some pharmacies reduce their opening hours because they can't afford to keep the doors open. And we have seen those closures. So unless something drastic is done, we will continue to see closures. And to me, that is a patient safety risk.
What are Labour saying they will do to help pharmacies? Are you hearing anything positive from them?
Well, all the main parties seem to have addressed pharmacy in some context. I think some of the interesting facts that some of the parties come across is this independent prescribing, so how we can make better use of pharmacists. We've heard the Conservatives talking about Pharmacy First, which is that 7 common conditions which you can access care for in a community pharmacy. But again, this is all more work, but very little about how they're actually going to fund it. We can talk about how fantastic it would be for pharmacies to do more, and we are capable of doing more. But we are overstretched with the funds that we have at the moment. And it is patients who are going to see the brunt of this. That's why you walk in at the moment and you'll probably see a queue to talk to your pharmacist, for example, because we've also got staff. Staff don't want to work in a community pharmacy environment where it's quite stressful. And I'm sure you can work elsewhere for better pay, to be honest.
OK.
All right, Thorrun. Well, good luck with your protest. That's Thorrun Govind, pharmacist and health expert. And interesting that they're not choosing to go on strike in the way junior doctors are planning to go on strike next week.
I love pharmacists.
Yeah.
It's my first port of call. Sue at Busby's in Chiswick. I even go in there and I buy some of my beauty stuff, moisturisers and things, and suntan lotions, and it costs me more than if I went to Amazon and bought it. But I want to do everything to keep those little pharmacies going.
Terrific.
We need to support them. We really do.